Something I see that's very common is this left upper trap, scapular upper back area, and potentially even neck discomfort. And it's predominantly on the left side a lot of the times, which is quite interesting if we consider how the human body is naturally asymmetrical and how our positions of the scapula and the rib cage and the spine feed into why this is so common in people ranging from general population to lifters to athletes and anyone in between. If we can agree that there is a heart on the left side of our body and a liver on the right side of our body and our brain is asymmetrical, then we're in full agreement that the body is factually and naturally asymmetrical. And there are a lot of reasons, as I mentioned in other videos, why we are in this asymmetrical orientation I'm about to talk about. I will link that video, but just for the purposes of this video, I'm going to be discussing how our pelvic and ribcage position feeds into this left upper trap problem that we commonly see. So, our pelvis tends to be oriented to the right. And because our body seeks equilibrium and more of a neutral orientation, what ends up happening is that the right shoulder comes forward lower than the left because we rotate our trunks back to the left in order to even ourselves out. If the pelvis is going to the right, then we're probably going to have to turn this way. And you can see on me what just happened within my upper body. Now, I wish that this orientation right here were the end of the story and it was that easy, but it's not that simple. So this is a right scapula right here, but bear with me. I'm going to try and explain the left scapular position in more detail, but basically because the right shoulder's forward, that scapula gets pulled into more of a winged orientation, meaning that it gets pulled away from the spine a little bit more than the left one, because this right scapula is in more of a relative state of abduction and also upward rotation, which is going to bring that right shoulder low. On the left side, the left scapula is going to be closer to the spine and more of an adducted orientation and more of a downward orientation as well. And it's also elevated because of this position right here. So basically the left scapula is being pulled closer to the spine, which creates compression within the space between the scapula and the spine that's supposed to naturally exist. Now we have a big cavity called the posterior mediastinal cavity on the back side of our rib cage. When we breathe in, that area is supposed to expand, and what's supposed to happen is that the scapula needs to externally rotate and downwardly tip like this. So the right scapula has room for when we breathe in and expand that cavity to actually move into that orientation. Unfortunately for the left scapula, because it's already pulled closer to the spine, it's kind of glued there, so to speak. So it is in this adducted, downwardly rotated, and also externally rotated state. So it's already in a position where it needs to move when we inhale. So it's stuck, and that posterior expansion is going to be more limited on this left side. A common example I see with athletes and also just general lifters is when they go to retract their shoulder blades or when they go to do a row or a press, they notice that their left side feels a little bit more uncomfortable a lot of the times. Not always, but a lot of the times. So they'll say things like, I feel like my left shoulder just doesn't move as well as my right. I feel like I can't press as well. I don't feel as stable on that left side. And that's because the right scapula can be pulled back into an orientation where it can provide that stability, but it's harder for the left side to be pulled back into an orientation where it's already glued, so to speak, to that spine. Because of this scapular position right here, we're more prone to have tightness in the mid-upper back on the left and also within that upper trap on the left because it's naturally in a higher state. I encourage you next time you're just walking around and watching people stand, look at how many people's right shoulders are lower than their left. It's not always, and it's not black and white, and this is not every human because people tend to compensate and not everyone is the same, but it is quite common. The most commonly easy way to facilitate this left posterior expansion would be to actually provide the best way to get the most commonly easy and simple way to get this left posterior expansion would be to provide an exercise and constraints to allow for air to travel back there, primarily when we inhale. So the way we can facilitate this most easily is to get the oblique on the left, which is usually in a lengthened position, as you can see in the image up there, to actually fire and become more concentrically oriented or tight. And then we can also get a position where we're reaching with our left hand down which when we reach down below about 60-ish degrees relative to our trunk, we're going to eccentrically orient those tissues within our left neck, within our left upper trap, and left posterior rib cage. So if we can get in those positions and we can bias them and breathe through them in a comfortable manner, we can effectively take stress off of the left trap in most cases. Here are a couple of exercises I really like for exactly that.
Get a light dumbbell and reach it with one arm actively towards the ceiling, and then reach your elbow at a low angle towards your knee that you're pulling back. Make sure your opposite side hamstring stays pinned on the wall and you're pushing into that wall with the flat foot with your heel, and then maintain that as you breathe in through your nose and out through your mouth. As you exhale through your mouth, you should feel your obliques, your side abs, on the same side of the leg that you're pulling back. If you feel like you can't pull that knee back without getting a hip flexor cramp on the same side, just pull that knee back less and seek to improve it over time, but still reach that elbow. What we want to avoid is bringing that other hamstring off of the ground like that. Make sure it stays pinned. Also, make sure you're not bringing your head off the ground and crunching. Place a cable machine on a high setting, or just attach a band to something that's tall and place that band high on it, and then get a double underhand grip on that rope attachment or the band. Place your outside foot forward in the split stance position, and then focus on turning your trunk and pelvis into that front side leg. You want to keep the angle of the reach low here with slightly unlocked elbows. So notice how I'm turning into it. That's going to give me some front leg adductor or inner thigh, and also obliques or side abs on that same side. And I'll also feel a stretch in the opposite side upper back. So to summarize, I'm going to be feeling my right inner thigh, my right obliques here, and a stretch in my left upper back. Hold that as you exhale through your mouth to feel your obliques even more, and then pause with your mouth closed. Inhale on top of that, and you should feel an even greater stretch in your upper back. Just make sure here you're not maximally cranking and turning into it. We don't want this to be a max strength exercise, so make sure that you're doing it with moderate intensity.
If you are experiencing this issue on your right side, I recommend you reach out to me if you want to work together online, and I can also provide you some more resources on what could potentially be going on.